A Guide to Supplements for Anxiety. For betterment of cognition or improving focus and mental stamina. Alpha GPC, choline, a more potent supply of choline as compared to lecithin. It is a great auxiliary substance to piracetam, which depletes acetylcholine. Ergo, adequate transmission will be maintained. Aniracetam, a nootropic, memory, learning-enhancing dietary supplement that is immensely useful when your thinking is obscured by anxiety. Depersonalization often causes brain fog, and therefore I found it to be a helpful implement when learning or working. Furthermore, it is also exhibited anxiolytic properties in laboratory mice via action on dopamine. Take 2 to 3 750 mg pills daily. Centrophenoxine, meclofenoxate. Acetylcholinesterase inhibitors reduce the breakdown for acetylcholine, an essential transmitter involved not only in muscular function and other somatic bodily aspects, but also in cognitive processes such as memory. Additionally, this supplement was proposed to cause up regulation, increase in density of dopamine receptors through a compensatory mechanism, inhibits release of dopamine resulting in sensitization of corresponding receptor sites. Thus, the effects arising from this mechanism will only be felt after the cessation from chronic administration. Overall, an interesting nootropic, which helps with focus and the consolidation of new information into long-term memory. Piracetam, another nootropic from the racetam family that improves cognition. It acts as a positive allosteric modular of the NMDA glutamate receptor, which proved essential in learning and memory. Dissociative drugs such as ketamine are NMDA antagonist, placing them opposite the piracetam, and since depersonalization is a form of dissociation, it might prove to be helpful. 1.2 grams to 12 grams is a typical dose range. Efficiency varies among individuals, so you will have to find the right dose for you. Combines well with aniracetam, lecithin, alpha-GPC, centrophenoxine, because they work in synergy. Fatigue relief. BCAA, branched-chain amino acids, comprised of 3 amino acids, valine, leucine, and isoleucine. This supplement will find its use not only in bodybuilders who are looking to gain some muscle tissue, but also in those struggling with fatigue and depression. Because amino acids are essential to protein synthesis, which make up almost every cell and structure in our bodies. It can't hurt to provide yourself with the bodily structural basis. Works great in alleviating physical exhaustion or fatigue, which is inherent to depression and anxiety. Rhodiola rosea, a plant-based supplement which is thought to alter the levels of serotonin and dopamine to our mood's favour through monotonin oxidase inhibition, enzyme breaking down neurotransmitters. This plant has been used in Siberian and Scandinavian countries for centuries to alleviate stress and depression. If it has helped people in such desolate climates and conditions, its beneficial properties shall not be ignored. The active ingredients of this plant, rosavins, provide among the above-mentioned reduction in fatigue by increasing your mental and physical stamina, as well as making it a great aid in depression and exercise. Relaxation. GABA, a supplement that is essential in regulating anxiety. GABA, in this supplement form, does not readily cross the blood-brain barrier, BBB, in lower doses. Nevertheless, it indirectly calms you down. The exact mechanism is yet to be elucidated, but as the name suggests, it might be involved in regulation of the inhibitory transmitter, GABA. Majority of our brain is an inhibitory role, not a productive one. When there is a lack of inhibition, anxiety and/or other symptoms often arise as a result of information overload. Once or twice a day of 750 mg should be enough morning or evening before sleep. This dose can be exceeded, but in such cases it may have paradoxical effects and work against you by increasing anxiety. Lecithin. Not only does it reduce the frequency and severity of migraines, but it also helps you to achieve an overall calm state of mind. I found it to be outstanding in reducing panic attacks, which many people report, along with depersonalization. The cholinergic system is involved in memory and learning, among myriad of other sympathetic and parasympathetic responses. Therefore, lecithin, being a precursor to acetylcholine, will positively address cognitive impairments such as brain fog. L-theanine, extract from green tea that invokes a focused state of relaxation without making you tired or overly stimulated. Along with its nootropic properties, it is also a worthy mood enhancer. 400 to 800 mg daily should do the job. Improvement without noticeable sedation or stimulation. Vitamin B. Chronic supplementation of B complex has been shown to reduce work-related stress in addition to attenuating confusion and depression. I recommend using the sublingual form inaccessible due to its high bioavailability. It is difficult to overdose on B vitamin since it is water-soluble, so don't be afraid to incorporate it into your daily diet. Omega-3 or 6. Also known as fish oil, this dietary supplement supplies plenty of benefits to not only psychiatric patients suffering from anxiety by reducing its symptoms, but also by actively involving in prevention of cancer, inflammation and depression. Magnesium. Deficiency can precipitate depression and anxiety, so make sure to keep proper levels in check. Usually magnesium is contained in sufficient daily amounts in green vegetables, but if you need immediate relief, magnesium can act as a gateway to sleep and calmness. Zinc. Zinc levels on its own are rarely relevant. More important is the zinc-copper ratio that determines functions necessary in keeping a healthy mindset. A low zinc to copper ratio has been correlated with autism and increased prevalence of violent behavior. Furthermore, zinc has been identified in some neurons, specifically in synaptic vessels, where it might aid cognitive functions. Although supplements can be of great help when treating anxiety, they are not the only possibility, and nor are they the most effective approach compared to techniques such as exercise, meditation, exposure therapy, and so on. Consider supplements as catalysts to attaining better mental health, and for maximum effects, interweave their use with other methods suited for anxiety relief.